CNN's Dr. Sanjay Gupta, a CBS News contributor, has been looking over Senator McCain's records. And Sanjay, describe the scene. I understand that there was a lot of time spent going over these records.
Yeah, I mean, there was over 1,200 pages of records, Katie, and they gave us 3 hours essentially to look over them. It was kind of like medical school and residency all wrapped up into one. They took us into this room, laid out 3 big piles of papers, and said, basically go through this. That was sort of the scene, and so we spent a lot of time just reading through these papers.
And what areas did these medical records cover?
They were pretty comprehensive. It was pretty remarkable to get that level of detail about a candidate. I mean, obviously, a lot of people focused on his skin, on his melanoma history. This is a person who's had 5 different skin cancers, 4 melanomas, and then we found out today that he had a squamous cell carcinoma as well in February, removed off his leg. A lot of people focused on his heart as well, looking at heart tests from 2000, comparing them to 2008. I can tell you that his heart function seemed good in 2000, and it seemed the same in 2008. Looking at his medications, he's on 6 different medications for his kidneys, for his cholesterol. He takes Ambien occasionally for sleep, medications like that. He sees 8 different doctors, Katie, just to give you a sense of how many doctors are involved with his care. And you'll be pleased to know, Katie, that he had a colonoscopy in March, and he had 4 benign polyps, adenomatous polyps, removed at that time. So that was good for him as well. The last colonoscopy before that was in '97.
Let's talk about the skin cancer, though, Sanjay. I think that's what has been the source of the most speculation. He got an all clear on that, but how concerned are doctors that this skin cancer may, in fact, return?
Well, I think that when you talk to them and they sort of describe it, they say they're not very concerned about this at all. They think that he's had these 5 different skin cancers, but he's never had a recurrence of any one of them. These are 5 distinct skin cancers. But if you have to assign a percentage to this, what they'll tell you is that the most serious skin cancer was in 2000. At that time, he had a skin melanoma removed from his left temple, and people noticed those scars on his face.
Right.
From that point forward, they said he had a 66% chance over 10 years of it coming back. That was 8 years ago.
So clearly he's being monitored very carefully, and he's probably getting skin exams. How often?
Well, Dr. Suzanne Connolly is his doctor. She says every 3 to 4 months he shows up, gets his skin completely examined. His wife, Cindy, has been taught to examine him at home as well. Almost regularly, daily, he's getting some sort of skin exam and then by a doctor every few months. Let's
talk about his cholesterol-lowering medication and his cholesterol in general. What do you think of that, doctor?
It was very interesting. He was on a medication called Vytorin, and that is a medication that had a study about it recently that showed that maybe it wasn't as beneficial as people thought. So his doctor switched him to a new medication called simvastatin. What I can tell you is this: his cholesterol is 192. Not bad, but not great. It's not optimal. But it came down from 236 5 years ago. So the medication seems to be working. Total cholesterol is down. His good cholesterol is up. His bad cholesterol is lower, so everything seems to be headed in the right direction. But I wouldn't give him an A+ or anything here, Katie, as overall his cholesterol scores.
What would you give him then?
I'd probably give him a B. I think he, it's kind of funny grading a presidential candidate, but I think that the most doctors, I think, would probably like to see those numbers a little bit better. Keep in mind, he trots out his 96-year-old mother on a lot of these campaign stops, and she looks great, in fairness. But his father died of a stroke at age 70, so this is something that he has to think about.
Does he exercise much?
Well, right now, he's lost 6 pounds over the last several months. He says it's mainly just from the frenetic pace of the campaign trail. He does exercise from time to time, although he admits that it hasn't been a lot lately.
Let's talk about the 5.5 years, Sanjay, he spent as a prisoner of war. He was tortured. I know that he has some limited range of motion in his arm and shoulder. How has that affected his overall health?
I find that very interesting. They talk about this quite extensively in the records. He was a POW for 5.5 years. He was beaten. He was tortured. He broke both sort of surgical heads right in this area of his arms that leads to the shoulder. You'll notice when you watch him, Katie, I'm sure you've noticed, he cannot lift his arms over his head. It is because of those injuries. And doctors in the medical records noted that he may need bilateral shoulder replacements, both shoulders replaced at some point in the future, which that's a big operation. We talk about knees and hips, but shoulders really takes you out of commission for some time. He may need that at some point in his life.
Anything strike you as remarkable in terms of what you read today?
Well, I think the fact that, he had so many different doctors looking after him, I thought was interesting. 8 different doctors, all from the Mayo Clinic. He's obviously very serious about getting his health care. What I didn't see, I thought, was interesting as well. There was hardly any mention of his mental health. This was something that people talked about a lot in 2000, as you remember, but hardly any mention of it now. He has some sleep problems because he takes Ambien. He used to take melatonin, but every single note in his charts from 2000 forward started with, Senator John McCain is a pleasant, cooperative patient. That's how they started every single note, and there was no mention of depression. This is a man who had 2 admittedly weak suicide attempts when he was a prisoner of war. There was no mention of post-traumatic stress disorder or anything that may have been asked, or substance abuse, and none of that was even mentioned.
All right, let's bring in Dr. Jon LaPook, because he's been taking a look at the health of past presidents. How does John McCain compare?
I think he does very, very well. Remember, we go back to FDR, who had high blood pressure and heart disease, which, by the way, was hidden from the public.
Not to mention his polio.
And his polio. We have President Reagan, who developed cancer of the colon while he was in office. And then McCain's LDL, the bad cholesterol of 123 when he's 71 years old, did pretty well compared to Clinton's of 134 when he was 53. Of course, we know that Clinton went on to turn out to have heart disease. And fortunately, the good thing about it, and Sanjay mentioned this, is that today, when we have these numbers, we always like to point to the numbers, right? And his LDL is this and his blood pressure is that. But we have medications now that we can dial down these numbers to whatever number we really need. So I think now the whole world's looking at him. A lot of specialists are looking at him. 8 doctors, now they're going to be 8,000 doctors giving advice. And I think you're going to see over the next few months maybe some other people putting in advice and saying maybe the LDL should be a little bit lower.
How did he do on his stress test? Because past presidents have done stress tests as well.
He, at 71, did 10 minutes, which was the same as George Bush Sr. did at 64. Now, the winner was George W. Bush, who did 25 minutes at age 61.